70, where the 70 was a
Hey,
little consequence.
did you know that there are only 3 NBA team names that don't end with an S?
You know you're giving me a headache with your stupid questions.
Did you know that I can do this?
I don't feel so good.
Man, when's the last time you ate?
Diabetes mellitus is a group of diseases characterized by high levels of blood sugar or glucose. People with diabetes are unable to break down and use glucose and are in need of medication that assists the process. Over 18 million Americans have diabetes, and the number is rising due to our increasing obesity. 1/2 of all strokes and heart attacks are related to diabetes. Diabetic emergencies fall into 2 categories: high blood sugar and low blood sugar. Now let's learn how to recognize and respond to them.
Okay guys, high blood sugar and low blood sugar. It's self-explanatory. We'll deal with hyperglycemia, high blood sugar first. This condition develops over the course of several days. Because of its gradual onset, high blood sugar is usually noticed before it becomes an emergency. Hypoglycemia, or low blood sugar, can occur rapidly within minutes and therefore is the more serious of the two. It's caused by taking too much insulin or not eating enough. In this state, the brain lacks the necessary glucose to function. It can quickly progress to confusion, loss of consciousness, seizures, or even death. So we need to recognize the signs and address them quickly. These signs include altered mental status, such as confusion, irritability, or aggression, nervousness or anxiety, pale, cool, moist skin, dizziness or headache, fatigue or weakness, hunger, full rapid pulse, tremors or seizures, or unresponsiveness. Because hypoglycemia is more serious, treat every diabetic emergency as though it were low blood sugar.
So if their glucose is high, give them more sugar?
I know that sounds confusing, but the condition of low blood sugar needs sugar desperately, and a small bit makes a big difference. In the case of hyperglycemia, the blood sugar level is already so high that adding a little bit won't make much difference. So, this is what we need to do. First, we perform the ABCDs, call 911 if needed, and keep the patient comfortable. If the patient is conscious, administer sugar. If they're drooling, however, do not put anything in their mouth because they won't be able to protect their airway. Some examples of foods or drinks that can quickly raise blood sugar levels are orange juice, non-diet soda, sugar dissolved in water, hard candies, cake frosting, honey, or syrup.
70, where the 70 was a little consequence.
I don't feel so good.
Man, when's the last time you ate?
I don't know, like this morning or something?
I think you might need some sugar. Thanks, man. Anytime, babe. And those teams are?
Jazz, Heat, and Magic.
A poison is defined as any substance, solid, liquid, or gas, that causes injury or even death when it enters the body. There are 4 ways that poisons enter the body: ingestion, or swallowing; inhalation, which is breathing dust, fumes, gases, or mists; absorption, through the skin; and injection, such as with a hypodermic needle, bite, or sting. In 2002, 2.4 million exposures to poison were reported, and approximately 92% occurred at home. Half of the poisonings occurred in children younger than 6. These potential tragedies can be easily avoided with some very basic common sense steps. Lock all dangerous items out of sight and reach, including medications, household chemicals, and personal care items. Return items to storage immediately after use. Keep products in their original containers. Buy household products and medications in child-resistant packages. Never call medicine candy. And contact your local poison control center to find out more about childproofing your home.
Poisons act fast, so you should too. These are the things to look for: throat and abdominal pain, nausea and vomiting, drooling or unusual odor on the breath, behavior changes, disorientation or unresponsiveness, difficulty breathing, sweating, seizures, burns, redness or blisters around the mouth, empty containers or disturbed plants. When treating, make sure the scene is safe and check for clues as to the possible cause of poisoning. Remove the victim from the scene if needed and perform ABCDs. Try to identify the poison, how much, and when it was taken. If the victim is disoriented or unresponsive or in distress, call 911. For poisoning victims who are not in distress, contact the Poison Control Center. In most regions, the number is 1-800-222-1222. Do not induce vomiting, and do not give them anything to eat or drink unless instructed to do so by a medical professional.
Every year, many lives are needlessly lost due to a seldom considered killer: heat. When the ambient temperature is 93 degrees, the temperature inside a car can reach 123 degrees in just 20 minutes. We've all heard of tragedies like a person leaving their baby locked in the car while they go shopping, only to find it near death or dead upon their return. A heat-related condition can quickly become a true emergency that needs immediate attention. These situations commonly occur when the temperature is above 100 degrees, there is high humidity, and there is little to no breeze. Most of these emergencies happen to people older than 50, those who have chronic illnesses, and people who work or play outdoors.
The simplest heat-related emergency is heat cramps, which usually occur during intense exercise in a hot environment. To treat a heat cramp, leave the hot environment, rest and cool down, gently stretch and massage the cramping muscles and replenish body fluids. Now, the more serious emergencies are heat exhaustion, which appears similar to shock and heat stroke, a life-threatening condition. Symptoms of heat exhaustion include pale, clammy skin, heavy perspiration, elevated temperature, intense thirst, fatigue, weakness, faintness or anxiety, headache, cramps, and nausea. If heat exhaustion is not treated, it may progress to heat stroke. During heat stroke, the body can no longer regulate its temperature, and its cooling mechanism, which is sweating, fails. This can lead to brain damage if not treated immediately and aggressively. The heat stroke victim will have hot flushed skin, a body temperature above 104 degrees Fahrenheit, disoriented or unusual behavior, unresponsiveness, increased heart rate, rapid shallow breathing, and sometimes seizures. Because heat exhaustion can quickly turn into heat stroke, both are treated in the same manner. We perform the ABCDs and place the patient in the recovery position, or begin CPR if needed. Activate EMS, move the victim to a cooler location. Put modesty aside and loosen or remove any clothing. Rapidly cool the patient with water to the head, neck, armpits, and groin. If the patient begins to shiver, dry and cover the patient.
Most heat-related emergencies can be avoided altogether with some basic preventative steps. Drink plenty of fluids before, during, and after activity. Increase time spent outdoors gradually to allow the body to acclimate to the heat and humidity. Perform the heaviest work or activity during the coolest part of the day. Keep yourself shaded as much as possible with a hat, sunglasses, or umbrella. Do not eat large meals before working in a hot environment, and avoid drinks that make you lose water, such as alcohol or drinks with caffeine. Heat isn't the only environmental threat. Cold can be equally dangerous. Spending time in cold weather or water can quickly lead to hypothermia. This occurs when the core body temperature drops from its normal 98.6 degrees to 95 degrees or below, and the body begins to lose more heat than it produces. This most commonly occurs in water because the body loses heat up to 25 times faster when submerged. The elderly and the very young are most at risk.
Hypothermia and frostbite are the two cold-related emergencies we'll be covering. Symptoms of hypothermia include cold gray skin, drowsiness, slurred speech, exhaustion, unresponsiveness, an abnormally slow breathing rate, and an absence of shivering. If you recognize any of these symptoms, perform the ABCDs and activate the EMS. Move the victim to a warm environment, replace damp clothing with dry, and cover with blankets. Insulate the head, as this is where 70% of body heat is lost. And there are some very important things not to do. Do not manipulate the extremities because you could force cold blood back into the heart, which could induce cardiac arrest. Do not give alcohol or coffee. And do not apply direct heat, but instead apply a warm compress to the chest, groin, and neck. Another cold-related emergency is frostbite. This is caused by prolonged exposure to the cold as body tissues actually become frozen. It most commonly affects the hands, feet, cheeks, ears, and nose. The things we look for to identify frostbite are cold, pale, waxy skin, a painful burning sensation, numbness, and blisters. So, we encounter a victim that appears to be frostbitten. Perform the ABCDs, call 911, and remove the victim from the environment. To warm them, give them dry clothing and place the frostbitten part next to your own body. Avoid partial thawing and refreezing, as this may cause severe tissue damage. Do not rewarm with direct heat and do not rub frostbitten skin. Keep warming the frostbitten areas until normal sensation, movement, and color have returned. Cover the affected areas with dry, sterile dressings.
Some helpful tips to prevent these types of emergencies are: wear clothing in loose layers to keep you warm in cold weather. They should be windproof and water resistant. Be sure to cover hands, head, and feet and keep as dry as possible. Pay attention to early signs of hypothermia. Take frequent breaks indoors to warm up and avoid overexertion. Keep your vehicle in good repair.